So our first patient is 25-year-old man. He just got into an accident. Basically, he is fine because they already said that he's hemodynamically stable. His classical coma scores. But we still need to do some other tests to rule out any kind of internal brain injury. We need to do those tests to rule out any brainstem or any internal brain injury. That's why over here we are doing what we call the caloric test. Okay, caloric test to check any internal or brainstem injury. So what we do over here is we do cold and warm water irrigation, and we see the eye movements basically, which we call the vestibulo-ocular reflex, right? These basically test your semicircular canals, they test your acoustic nerve and the brainstem basically. What we do is, first of all, we need to check the external auditory canal because we're going to put in the water up there. So we need to check that there is no obstruction, it's clean, and eardrum is also fine and not perforated or anything like that. Then we put the patient in the semi-recumbent position as they mentioned in the question up here. Okay, we put the cold water first and then the warm water. What you're going to observe is some kind of a slow movement of the pupil along with a fast movement, which we call the nystagmus, or we call the saccadic eye movement. We use a mnemonic to remember, especially with cold water and the warm water irrigation, that we call CALS, which is cold for opposite nystagmus and then warm with same nystagmus. So what happens over here is that when you put in the cold water, your eyes move towards the same side where you put in. Let's say you put in your right ear, right? Your eyes are going to move towards the right side slowly first, right? And then it's going to correct itself towards the opposite side. So the cold water causes ipsilateral slow pursuit with contralateral fast correction or the nystagmus. The opposite thing happens with warm water. If you put in warm water in your right ear, your eyes are going to move first towards the left, so that is contralateral slow pursuit with ipsilateral fast correction or the nystagmus. This is what we see in normal patients. But what happens in comatose patient is that nystagmus is what gets lost, right? And in brain dead patients, the whole examination is negative. You will not see any movement, right? The saccadic movement is the fast correction, we call it. And we also call them nystagmus. Your eyes are going to move slowly towards the side where you put in the cold water in your ear, let's say right side, especially with the cold water. And it's going to do the fast correction towards the opposite side. That fast correction is what we call saccadic movement. Okay, and we also call them nystagmus. And if you remember over here, C is the correct answer. Warm water causing ipsilateral saccadic movement. As I mentioned, warm causes same side nystagmus. That's why it's called ipsilateral saccadic movement. Cold water, option A, it causes contralateral saccadic movement and not ipsilateral. B option, warm water causing contralateral slow pursuit. Okay, that's why that is wrong. Warm water mimicking head turning left. Over this, the head turning left, this is another reflex, what we call doll side reflex, or we call the oculocephalic reflex. So when you move your head towards the right side, your eyes are going to fix towards the midline and they're going to remain the same way even when you're looking towards right. And then it's going to correct itself wherever you see it. So warm water mimicking the head turning towards the right because the right ear is what we are going to put in the warm water. So over here, it's not left, it's going to be the right side. Cold water causing contralateral slow pursuit. It's not contralateral, it's going to be ipsilateral slow pursuit. And that's why rest of the other options are incorrect. To understand this examination in a better way, you can watch videos. They have really nice videos on YouTube as well. When you see it performed on a patient is when you will be able to better understand what ipsilateral and contralateral movement would mean when you put in the water. So these are some of the ways that we just check, especially in trauma patients. So saccadic and slow pursuit movement. Slow pursuit means your eyes are gonna automatically move, or it's gonna remain either in the same direction or it's gonna move slowly in the same direction. Now this depends on if you're using cold or warm water. Sorry, I'm explaining again because somebody asked a question. If I can explain again what saccadic and slow pursuit movements are. right? So slow pursuit movement means, let me explain it in this way, that you put in cold water in your right ear. Your eyes are going to slowly move towards the right side. It just happens. It's a reflex, right? And that's why it's called a vestibular ocular reflex. Your ears, your vestibular system, and your eyes are kind of connected through the brain stem, and that's why we have these kind of reflexes. Your eyes are going to move a little bit towards the right side with a fast correction towards the left side. That fast correction is what we call saccadic movement, and that slow movement is what we call the slow pursuit. That saccadic movement is also called nystagmus. And slow pursuit saccadic movement, we also use words ipsilateral versus contralateral. So don't get confused. Make sure you watch a video. They have really nice videos on YouTube. You will be able to better understand the position, the head position, where the eyes are moving, which direction you're nystagmus. Okay, and these all are just neurological examinations, basically.
Thanks for watching. Please give a thumbs up and subscribe for more.